Over the last few decades, there has been a lot of awareness about liver diseases. The most common liver disease that affects Indians is alcohol-related liver disease. Metabolic dysfunction associated steatotic liver disease is another upcoming epidemic, and that is because of poor lifestyle. Hepatitis B and C are common causes of viral hepatitis that cause acute and more commonly chronic liver diseases. Apart from that, hepatitis viruses A and E can cause acute viral hepatitis and at times can also give rise to life-threatening acute liver failure. Other diseases that affect the liver include primary sclerosing cholangitis and primary biliary cirrhosis that affects the bile ducts, and autoimmune hepatitis, which is an autoimmune phenomenon where your own body fights against your liver and can cause liver cirrhosis. Certain drugs and complementary medications can also give rise to liver diseases. Certain genetic disorders can also cause liver disease like Wilson's disease and hemochromatosis that arise due to copper and iron metabolism problems.
The need for a dedicated liver ICU in Mumbai arises due to the increasing prevalence of liver diseases and the complexity of managing critically ill liver patients. You'd be surprised to know that in the last decade itself, India has listed amongst the top countries with an increasing population of patients with liver diseases. And in India itself, patients with liver diseases are amongst the top 10 causes of mortality. Managing liver disease itself is a complex issue. It requires a dedicated team with a world-class infrastructure. You'll be surprised to know that there is very limited availability of this kind of specialized care in Mumbai and in India itself. We at Apollo Hospitals see that with India's increasing population and increasing burden of liver diseases necessitates a dedicated liver intensive care, which is an investment in improving the city's healthcare infrastructure and can help to reduce mortality, improve quality of life, and establish Mumbai as a hub for advanced hepatology care.
Apollo Hospital Navi Mumbai has a state-of-the-art critical care unit. We are rendering the services not only in the basic but advanced critical care also. Under one roof, we are offering the services like ECMO, which is used in the patient who has a severe ARDS and cardiogenic shock. Along with that, we have a CRRT, which is useful in the patients who are hemodynamically unstable and require dialysis.
We have a dedicated liver ICU which caters to the patient with the sickest form of liver disease like acute liver failure, acute and chronic liver failure, chronic liver disease decompensated with gastrointestinal bleeding, hepatorenal syndrome, spontaneous bacterial peritonitis, and hepatic encephalopathy. We often use various forms of extracorporeal devices like plasma exchange, continuous veno-venous hemofiltration devices for patients with liver failure, which is at par the latest standard of evidences. Apart from this, we also have a dedicated transplant ICU where patients stay in the perioperative period after their liver transplantation. In this ICU, we follow the strictest norms of infection control practice.